Well, a vascular surgeon is a surgeon that specializes in diseases or problems of the arteries and the veins. Basically, someone that takes care of the circulation. It's different than a cardiologist, who is somebody who mainly deals with the heart. A vascular surgeon takes care of all the blood vessels, essentially outside of the heart. I personally have been doing it for over 15 years. I got into it because my father was a vascular surgeon, and I was an engineer when I went to college, and this was a field that was a combination of medicine and engineering. There's a lot of engineering principles in vascular surgery. Now, what does a vascular surgeon do? Well, there are three different facets of vascular surgery. There is what we call patient evaluation and imaging. So we see patients in the office, evaluate them. We do our own testing, and we read all of those tests, which is predominantly ultrasounds. And then we have two phases of treatment. There's what we call interventional treatment, which are essentially what we call percutaneous or minimally invasive procedures. They're procedures that are essentially done with a needle stick or a poke, such as many of the vein procedures that we're describing today. Then there are actual surgical procedures, and those are procedures where there's actually an incision. In addition to that, vascular surgeons follow their patients. So many surgeons, they'll see someone, they might fix a bone, and then they may never see the patient again. But in vascular surgery, many of the patients have conditions that require them to see their surgeon on an ongoing basis. So it's kind of nice to have a relationship with your patients on a long-term basis.